In 1985, my son was diagnosed with something called hemolytic uremic syndrome. Now, at the time, no one knew what caused it, but today we know it's E. coli bacteria that causes it. Today, we can treat the patient with some antibiotics, and they almost always do better. But at the time, the only thing anyone knew to do was to treat him with dialysis and blood transfusions. Well, we had grown very accustomed to having nurses and doctors come in at all hours of the day and night and doing different things with him and giving him medications that we hardly took notice anymore as to the details of those things. But one night there was a nurse who came in and gave him some meds. She left, and a few minutes later she returned. She looked at his chart hanging in at the end of the bed on paper, and she abruptly left. That was very suspect behavior, so a little later I went to the nurse's station to find out what was going on. And the nurse there said, "Sir, if you'll return to your room, I'll come back in just a moment and let you know what I find out." So the nurse came back after a while, and she said, "Mr. Patrick, your son is going to be fine, but he was given medication that was intended for the patient next door." Now, you can imagine how concerned my wife and I were. We were already concerned we were going to lose our son, and now we found out he's been given medication that belonged to someone else. As a software engineer at that time, I couldn't help but think, what if we had computers to keep track of what was going on and what should happen next? What if we had computers and software that could tell us how to make good decisions? Well, just as a side note, my son's doing fine today. He's married and has 3 children of his own, and I'm very grateful for that. My name is Marvin Patrick, and I'm a senior learning consultant here at Cerner. I have about 30 years of experience developing people in a lot of different arenas: the Marine Corps, the CIA, Booz Allen and Hamilton as a software engineer and a project manager, about 2 decades as a pastor, and of late a professional development trainer in a hospital where I taught soft skills such as leadership and management and customer service. Well, today we're going to talk about the role of technology in modern healthcare. And we don't have to wonder what could happen if we had technology to help us in the healthcare environment. We know very well that it can help us a lot. So let's jump in. The electronic health record, EHR, this is an area we at Cerner know very well. We can keep track of what's going on with the patient, what their allergies are, what kind of medications they're on, what kind of diagnoses and problems they've had associated with themselves. But there are some difficult things associated with an EHR and some very encouraging things associated with it. Let's look at the good first. We know that one of the things that's very helpful is that we no longer have to look at the doctor's handwriting. All of this is stored digitally, and it's a lot easier for us to keep track of what's going on. We know that it's a much safer environment. We can keep those records not under a physical lock and key, but under software lock and key, so we can know that those things are a lot safer. The records are kept in a much more confidential environment now because of an EHR. And even though there are some challenges associated with people hacking in, this is still a much better method than keeping paper records. We know that it actually helps us with claims. We're able to recover money better than we were in the past. But what about the bad? We know, first of all, it's very expensive, especially on the front end. And we know that it's difficult because we have to teach people how to use the system, and sometimes we have to change their workflows. And speaking of change, that's not something we as human beings appreciate very much. Most people resist change. We also know that there are issues with systems being able to talk to each other. We call it interoperability, interconnectivity. How is it that we can share records between systems? And we know that a lot of times patients are complaining that the doctors aren't really looking at them the way they used to. My wife just recently told me she went to the doctor. The physician looked her in the eye at the very beginning of the appointment and then went straight to the computer and started typing and never looked at her again the whole time she was in the room. Well, we have now had some people say we need to go a little further here. Let's call it a comprehensive health record. Recently in HIMSS 18, there was an organization of whom I will not name who came out and said, this is what we need now, comprehensive health records. But Cerner jumped in quickly and said, we've been working on that for years. Cerner refers to it as longitudinal health records. This is not something new, even though there's a lot of work that needs to be done. In fact, when Zane Burke was asked about this, He said it's certainly going to take more than changing the name, and he's right. There's still a lot of work that needs to be done. What are we talking about with comprehensive and longitudinal records? We're talking about taking disparate systems and bringing all that information together so that we have a much better picture of what's going on. Being able to take data from multiple places and bringing it all together will certainly help us in this process. What we also know about our personal health record, there's a lot that's been said over the years about who should own the records. People have difficulties getting their records from one hospital so that they can take them to another hospital. Who's the owner of those records? I think most people would agree today it's not the healthcare system. Most would agree it's not the vendor. It's the individual patient. That's information associated with them, and they should be the owner. And so of late, Cerner and Apple have signed an agreement about how they can share data so that you can have it on your smartphone. And even this week, Apple has come out and said they've signed agreements with 39 organizations so that you can get your health record on your phone. What about telemedicine? I've seen some devices of late that will allow you to, through Wi-Fi, connect a small device to your smartphone. You put 2 fingers of your left hand and 2 of your right on a little device, and not only measures your heart rate, it measures your rhythmic patterns. That information then can be sent off to your cardiologist without setting up an appointment. Your cardiologist can look at the information and diagnose any potential problems very quickly. Barcodes for pharmacy. This has become a big deal of late. In 2006, there was a requirement that came out from the FDA that all medications had to have barcodes, and so now we can keep track in a much better way the person's name, what kind of medications they've been given, what the dosage should be. And if that's not enough, we now have QR codes, so we can store even more information. It'll tell us more about what's going on. EPCS, electronic prescribing for controlled substances, another hot topic in healthcare today. We know that we've got an epidemic on our hands. CDC says that 15,000 people die every year from overdosing on painkillers. It's all over the news, the opioid problem that we have in this country. And now we have a much better means through EPCS to control what's going on inside the pharmacy so that people aren't jumping around. We know that we've got people in the pharmacists themselves that are keeping track of what's going on. We know we've got 2-factor authentication that can be put in place for identity proofing so that people won't jump from one doctor to the next, taking a written prescription, altering it so that they can have more of what they want. Radiology is a very big deal. We know over the years there's a lot of advancement that's been done here. X-rays were done for the first time in 1895. The first MRI was in 1977. And while there hasn't been a whole lot done in terms of new types of radiology, there's been much improvement in these fields. And more than anything else, we know that now we have high-capacity storage and telehealth and artificial intelligence, machine learning that can help us in diagnosing difficulties and problems for people in a much better way. Well, we know in the near future there's going to be a lot more coming. We've talked about the comprehensive and longitudinal health record, and we know that there's more information that can be brought in from disparate systems, shared in one place so that we can get a better picture of what's going on. Interoperability is going to continue to grow as organizations are signing up to help each other and sharing data. The government's coming out in a stronger way saying that this must happen. We know that machine learning, artificial intelligence can be a huge help in being able to determine what's going on. There are some systems, some healthcare systems now who have actually put logic in place that will send alarms to clinical people to say, hey, there's a lot of opportunity here with someone because of the things we're measuring. There's a greater chance of sepsis, and we can jump on those alarms and help take care of those folks before they do have sepsis. Cloud-based systems is becoming a big topic also. Instead of storing all the information locally and the customers have to keep track of all the data that's going on, vendors would keep that information for their customers. A lot happening with Apple, a lot happening with Amazon, many people getting involved now in healthcare. Well, in summary, we know there's a lot of good things going on. Electronic health records, personal health records, barcodes, radiology, telemedicine, EPCS, and we could go on and on. talking about what technology is doing for us today. It doesn't solve everything, but it certainly helps us get a little closer to the things we're trying to accomplish. There's a lot of work to be done, and what's really exciting is that we here at Cerner get to be a part of helping improve people's health.